There's only one deadly cancer every one of you has the power to prevent. It's by far the easiest to detect, but it's also the #1 common cause of cancer that doctors are not trained to catch. I'm going to show you how to find it yourself, but first I need an assistant from the day. Normally I randomly pick one of you, but I have to find someone today who happened to be in the audience who had a mole that we were worried about. So it's Christine here. Christine, come on up, Christine. Welcome. How are you? So, where are you from, Christine?
I am from Long Island.
Long Island. Mm-hmm. And when did you notice this mole that you have?
I noticed it about a couple months ago, so it's perfect that I'm here today. And
good timing. So, the first thing you got to do is examine the mole. So, can I see it?
Yes.
All right, so, where is it?
Right on my back.
Oh, okay, so turn this, get this on the eyes. Okay, can you all see that, guys? That's the mole there. Everyone see it? How many of you have a mole like that you're concerned about? Put your hands up. We've got a couple folks up there. Okay, so thank you very much. So here's what we're going to do. You can turn back around. I'm going to show you the Abcde system for looking for melanoma. That's the one that we worry about the most. That's the skin cancer. It's not the most common one, but it's the one we worry the most about because it can kill people, young people and old people. So first thing you got to do is look for things that are asymmetric. So on the left side, I'm going to have all the benign options. On the right side, the ones that concern me. And you notice that the right-sided one has an asymmetric appearance. It's not nice and curved over. It doesn't look like you put a little piece of Play-Doh on your skin. This thing is very irregular. B is for border. Right? The border of a benign mole is nice and circular. Of a malignant one, it jumps all over the place because it's invading. It's crawling into your skin. Typical for melanoma. C stands for color. Notice how a color of a benign mole is sort of the same throughout it. But in a malignant mole, you have places where it's light and places where it's dark. D is for diameter. You want the diameter of the mole that you have to be less than 6 millimeters. Right? That's roughly the size of the back of a pencil. You know, the eraser part of a pencil. And E is for evolution. Right? It changes. So here's a benign-looking mole that over the course of several months changed into a malignant-appearing one. So which of those do you think you are concerned about? Has your border shifted much? Has it evolved?
The border and the change in color. But again, I'm not a physician, so not quite sure.
Yeah, but I'm going to train you to know exactly what we know about looking for moles. Now, to help me do that, I've got a colleague who's joining us, Dr. Elizabeth Tanzi. She's a dermatologist and expert in cancers. Come up, Elizabeth. Thanks for joining us. Thank you, Elizabeth. All right, so take us through.
Okay, well, the good news is we can all do a good skin exam with just a few things that we have at home. Great lighting, a chair, a handheld mirror, and a large mirror.
Good. You got all those. You just happen to have them on the set.
Perfect. And you want to do your skin exam either before or after the shower so you can look at the entire skin surface. Mm-hmm. And I like to start from the bottom up, so with the feet. So go ahead and have a seat.
Take our shoes off.
Okay. So you want to look at the bottom of your feet, in between your toes.
Okay. That way we match each other.
Yes.
Of course, these are impossible shoes to get off. She's leotards on. There we are. Good. All right.
So you want to take a good look with that handheld mirror at the bottom of your feet. So once you take a look at your feet, you want to look at the top of your legs. Okay, and again, this would be done disrobed. It's the easiest. Mm-hmm. Once you take a good look at the top of your legs, you're going to stand up and turn around and put one foot on the chair. Good. And with your handheld mirror, look at the back of your legs. Exactly, just like that, all the way out.
Now, I understand you actually found your own cancer.
I did. About 3 years ago, I found a melanoma on my leg. And
a
melanoma? It was a melanoma, a simple mole that had been changing. Very slight, but change is key because although it didn't look all that scary as it did in some of these photos, the key is change. So the dermatologist in me knew it had to come up, and it turned out to be melanoma.
So you saved your own life by finding a melanoma.
And the good news is you don't have to be a dermatologist to be able to find melanoma. You just have to do the skin exam.
Congratulations.
Okay, so now while you're standing, I'll have you come over to the large mirror. Okay, and with the handheld, I'll have you turn around, Christine. Take a good look at your back.
You can take your lab jacket back a little bit if you want.
Thank you. With the large mirror, take a good look at your stomach, chest, and since you can develop skin cancer on any skin surface, ladies, you have to look under your breasts. And, you know, the melanoma kills 1 person per hour in this country. But if you catch it early enough, it's almost 99% curable.
You guys hear that? 99% curable problem that we control.
We control.
All right. Now, the last thing is taking a picture.
Exactly.
Which I brought this little dime with me for a reason. When you take pictures of your moles, put something next to them the size of which you're sure of, so that we can tell if it's changing inside. Otherwise, you can't know for sure. So let's take a picture of your mole.
And this way, Christine can follow it up once a month or so. She can get an idea if it's changing, and then if it is changing, she needs to bring it to the attention of her doctor.
Is it a good shot?
It's a great shot.
I hope so. Thanks to my assistant, Christine. Thank you very much.
Thank you.
Elizabeth,
Thank you,
it was a
sir.
pleasure.